Good afternoon, everyone, and welcome to the One East Side Spark webinar series. Today is October 21st, 2021. My name is Christina Hudson. I'm CEO of One Redmond and founding partner of One East Side, and I will be your host for the program for today. One East Side Spark is a regional recovery and resiliency center funded by federal grant dollars, and this program is designed to help fortify your small businesses with the resources, expertise, and additional key areas of support. And the goal of these programs is to help our businesses thrive and to withstand future economic crises. Spark is a collaboration and a partnership, and I want to thank all the partners you see here on this screen. Our East Side cities, our chambers are partnered together to give the highest level of support to our local business community. And I want to thank everyone for all their hard work. This next slide shows you an overview of Spark's current programming, and that includes a database of financial opportunities and other resources, a private Facebook group that we use as a platform to help our small business owners connect with their peers. And one of the key components of our program is our free of charge one-on-one advising. Our federal grant pays for the time of these additional experts, so these advising appointments are at no cost to you. And currently, we are offering 2 hours of tax and accounting advising through our partnership with Clark Nuver. We also have a wonderful marketing expert, Daphne LeBlanc, that can work with you to promote your business on social media. And for general business advising, you can contact Sean Palmer at the Small Business Development Center for East King County. And through Sean, you actually also have access to a network of a number of different advisors with a variety of expertise across the board. Next, we have some of our upcoming webinars and programs that are also available at no cost. Next week, we're going to have a webinar on how to navigate the reconsideration process for the SBA EIDL loan opportunity, as well as talk about increases and advance grants. And one thing to note is all our webinars are on demand as well. We cover a variety of different topics that you can watch and learn at your own pace. Okay, so we're going to get going with our program. Today's webinar is all about everything you need to know about King County's new health order. Before we get started, I want to cover a few housekeeping notes. If you need technical help during the webinar, please use the chat box. We have staff on hand to try and help with any issues you might be experiencing. We also have links to pertinent documents in the chat box that you'll be able to access. The resources that we list here will also be available on our website and will also be included in a follow-up email to you. If you have questions for the speakers, please use the Q&A box. Feel free to share all of your questions here, and we will do our best to get as many questions answered as possible right here and right now. I want to note that this webinar is also being recorded, and we will get out a link as soon as it is ready. So let's get going with our program. Today, we have Shannon Braddock, Deputy Chief of Staff for the Office of the King County Executive. Also, we have Taylor Gaston, Program Manager 3, Policy and Government Affairs from Public Health, Seattle and King County. We also have Markham McIntyre, Executive Vice President from the Seattle Metro Chamber of Commerce, and Jill Jackson, Principal Public Affairs and Communications, and Bella Merritt, Manager Public Affairs, and they're both from Monument Advocacy. And now I'm going to turn it over to Shannon Braddock to go ahead and kick things off. Shannon.
Great. Hi, everybody. Thank you all so much for being here, for taking the time to participate in this webinar. The partnerships that we have with all the folks that Christina just mentioned, and with all of you to have the opportunity to talk about what the order looks like. And we've had, frankly, a lot of input from folks that have helped us to shape the order and help us to update it and make some changes to it as we've gone along the way and try to provide the appropriate kind of resources, which is, I know, what Markham and his team will be talking about a little later in the webinar as well. So I just want to say thank you to all of you. Before my colleague Taylor from Public Health gets started on a slide presentation, I just want to cover a couple of basics and sort of broad things about it, which are, why did King County do this policy in the first place? And frankly, it's because the COVID-19 infections were rising at a much higher rate, driven by the Delta variant, and our healthcare system was getting strained. And our public health teams know that vaccinated people are less likely to spread the COVID infection. So they made the decision to require people to verify their vaccination in places where there's a higher risk of exposure, to try to help contain it, really so that we can keep hospitalizations down, number of cases down, and prevent any further restrictions on businesses or kids attending school, any of that. We want our business capacity to stay as high as it can as we get through what is hopefully the last leg of this pandemic. So that is why we have started this policy where people age 12 and older will be required to show vaccines verification in certain settings. So I just wanted to be sure that people really understand and are kind of grounded in that. And then I also want to verify or share that while enforcement, I know a lot of people are concerned about enforcement and concerned about what could happen as folks are showing up and maybe not wanting to show their vaccine verification. Again, we have some resources available for that. Markham and his teams will be talking about that a little bit. And I also just want to share that from the county perspective, as I said, our goal is to keep businesses open. So if we hear about instances where businesses are not complying, our first step is always going to be education. We will be reaching out. We will be trying to ascertain how we can help, how we can provide resources to make sure that people can comply. And that is really always going to be our first step from the King County perspective. So really, as I said, really appreciate this opportunity from you all to provide some of this information, answer some of these questions, and then hopefully have everyone in a good position to both share out information and be able to direct folks to information as needed. So I think Taylor, if you're ready to walk us through the slides, that would be fantastic. And then I might, pipe in on occasion if to share a little bit more about that. And then my understanding is I think it would be helpful to have Taylor walk through her presentation and then pass it on to Markham and team, and then maybe hold questions until the end, just so that we can be sure that we've covered as much information as possible. So thanks, everybody. Thanks, Taylor.
All right. Hello, everyone. Again, my name is Taylor Gaston, and I do work on the Policy and Government Affairs team. And I am so happy to be here. And I'm hoping that I can be very informative and just really help answer some of the questions that we all have. So a little bit about the order. So the King County Local Health Order applies to large public events, indoor recreational establishments. So that's gyms, community centers, aquatic centers, restaurants, bars. All must require customers to show proof of vaccination or a negative test. Next slide, please. Okay. So as you know, that the local health order will be starting on October 25th. Customers will be required to show proof of vaccination or a negative test. So this would be for outdoor events with 500 people or more, and this includes all of our professional and collegiate sporting events and entertainment events. Indoor recreational events or establishments. So this is professional, collegiate, entertainment, sporting, performing arts, theater, live music, gyms, conferences, hotels. Again, community centers, aquatic centers, all would be covered under the order. And then when thinking about restaurants and bars, this is only for indoor dining. So the order will not apply to takeout or like a grab and go setting. So places that don't have a primary use of a restaurant that's dining in. So a good example that I always tell folks would be, so you wouldn't include like a Starbucks in a Safeway. That would not be included under this order, or like a mall food court, or certain offices may have like cafeteria style dining. That would not be included under this order. And again, a few more examples of the types of events. So for outdoor events, we're talking professional sports with 500 plus attendees, entertainment with 500 plus attendees, a convention, conferences, things of that nature. That would be outdoors. And then for indoors, again, professional sports, regardless of the size, entertainment, regardless of the size, dine-in restaurants, and then bars of any size. And then I'll talk a little bit more about if it's a restaurant with 12 or less seating capacity. And here we go. So beginning December 6th, customers will be required to show proof of your vaccination or a negative test to enter restaurants and or bars with seating capacity 12 or less. Now, this is just for some of our smaller businesses. We want to make sure they have time to prepare and just really be as equipped as possible to handle this new added lift to some businesses. So we just want to make sure that that is very clear. This is for restaurants, bars with 12 seating capacity or less. All right, so what is considered to be proof of vaccination? So this will be the CDC vaccine card, and this could also be a photo. Our county website has a ton of resources on how you can show the card or the photo. We have a video out right now where you can favorite you can favorite your vaccine card in your phone, so that way you don't have to dig through your phone to look for a picture. And so we also will be including documentation for a medical record or a vaccine provider. So for example, I have Kaiser Permanente, so I can pull up my KP app and I can just show my my medical record and it'll have my vaccine listed. So that's one way to show proof of vaccination, and then as well as proof of vaccination from another state or country. And then mobile apps from your healthcare provider. Again, that's what I was mentioning about the Kaiser Permanente, and then printed certificates or the QR code. Now, MyIR Mobile is pretty user-friendly, but there are some issues right now. We are working out those issues. I do have several resources that folks can use if they're having trouble with that, and I would be more than happy to share those with you, because again, we do have some issues currently with the MyIR mobile app right now. And a little bit about what MyIR Mobile is. So it is an internet-based portal that gives people access to their official state vaccination records. And then as you see listed on the slide, it's the website. And then you can also find it on the Apple Store or Google Play Store as well. Currently, it is only available in English. And so hopefully, I know there's some talk about it being offered in other languages as well, but that is currently only in English right now. All right, so if you are unvaccinated or cannot prove your vaccine status, there are options for you. We ask that you show proof of the negative PCR COVID test in the last 72 hours or a negative rapid test result from a testing provider that's conducted either on site or at the event or the establishment prior to entry. And so that can look a few different ways. You can either go to certain establishments will have testing sites right on the premises. So that would work for a rapid test, or you can just go to your local pharmacy, things like that, and just get your regular PCR test done as well. And lastly, this is our website where you can find a ton of information. Our comms team has been working very, very hard and diligently to get as many questions answered as possible. So we have an FAQ section that's always being updated, as well as a little bit more of the rationale behind this order, as well as other resources for businesses and for different partners that are just concerned about the order and just implementation things that some businesses may need some support on. And so we have most of that all covered on the website. And that is the end of my slides. I wanted to make sure we had time for questions if there were any, or maybe we'll do those at the end. But yeah, that's all that I had. Thank you all.
Oh, thank you, Taylor, so much. Now I'm going to go ahead and turn it over to Marco McIntyre from the Seattle Metro Chamber. Marco.
Thanks, Christina. Hi, everybody. I'm Marco McIntyre. I'm the Executive Vice President for the Seattle Metro Chamber. And as Shannon and Christina have both said, like, we've been partners with One East Side, King County, Public Health, and a variety of other organizations across the county on two goals for this project. As the order gets closer to being rolled out on Monday, we want to make sure that all the businesses in the county are aware that this is going into effect on Monday. And then two, for those that are going to be impacted, that they have tools and resources to make it as easy and as simple to comply, just like this webinar. So thanks for joining. So a reminder, the policy does go into effect on Monday, and at a bare minimum, businesses that are affected, the ones that Taylor mentioned in her presentation, are going to need to have some signage in their windows indicating to customers that they will be asking for proof of vaccination or a negative COVID test. You can find those that information at kcvaxverified.com. I will put the link into the chat here in a moment. And then we also have a variety of other tools there for business owners to consult, including our toolkit. We have translated the toolkit and a variety of the signage into a variety of different languages. So please visit kcvaxverified.com. That's kind of your one-stop shop for all your tools and resources to get ready for Monday. Today, what we're going to do is we're going to walk through that toolkit, give you kind of the highlights. And I'm going to be joined by Jill Jackson and Bella Merritt from Monument Advocacy, who are two of the authors of that toolkit. Then we'll run through some scenarios that are also available in that toolkit. And finally, jump back on, I think, with Shannon and Taylor and answer any questions at the end. So with that, I'm going to turn it over to Jill to kind of walk through a high-level version of the toolkit.
Sure, thank you. So this toolkit is really meant to be super helpful for businesses implementing the new order. We worked on it in partnership with the Chamber and with King County. We got a lot of really great feedback from local chambers throughout the county. And as Markham said, it's been translated into multiple languages. In fact, it's been translated into 21 languages. So this, again, can be found on kcvaxverified.com. It includes a number of resources, including signage. It has what counts as proof of vaccination, what counts as proof of a negative COVID test. It has ideas for employers who want to train or communicate about the order with their employees. And it also includes a number of scenarios. So scenarios that we believe restaurants or events that people working there might actually get into. And it also includes an implementation checklist, which we can go to next. We can move there. Oh, there's the signage. Here we go. And Markham, yes.
Yeah, so this is just supposed to be a reference guide to make sure that you feel as prepared as possible going into Monday. So first and foremost, it's making sure that your staff understands that this order is going to be going into effect and trying to empower them so that they're ready on Monday to be checking proof of vaccination. Second, as we mentioned, it's mandatory to have the signage available and in a way that customers can see it so they know that you're going to be checking their proof of vaccination. There's lots of ways to get that sign. We'll talk about some more of those at the end to make sure that you get it before Monday. The other thing to note is it's probably important. This isn't a requirement, but it's highly recommended that you communicate to your customers ahead of time that you're going to be checking for proof of vaccination. So whether that's on your website or your social media channels or any other ways where your customers are finding you, just letting them know that you're going to be checking proof of vaccination per the King County Public Health Order is probably a good idea, just so that at the door, whenever you choose to do that verification, they're kind of ready and prepped. Which leads us to this next point, is working with your staff to figure out where you're going to do the verification. The order is very specific and says that it does not have to be at the point of entry. So if you're a restaurant, you could do it as a person is seated. So figuring out what's the best flow for you in your business to make sure that proof is getting asked for. For venues that are going to provide rapid testing, figuring out how you're going to do that, making sure that your staff is well aware, making sure that customers are aware. This is generally for larger events that are going to be offering some sort of rapid testing at the venue, but it's important to make sure that it's consistent with what King County, the order is requiring, but also just that everyone's going to be aware of how that creates a separate flow of folks. Again, with the employees, kind of conducting the training so that they're they're aware of what they're asking for valid proof of vaccination or for the negative COVID-19 tests, but also really importantly, that they're well aware of the anti-discrimination policies that are baked into the order so that we're not making anyone feel unwelcome as they're coming in and you're asking for proof of vaccination. And then finally, just getting yourself familiar with the potential scenarios. And we're going to walk through a couple in a moment here, but we thought this was just, and we heard from businesses that this was going to be helpful to just kind of, what are the different flavors of interactions that your staff might have, how to kind of prepare them and make sure that they're feeling confident as they're starting this new process as well. So these are all in the toolkit, but we'll go through a couple of them in a moment to kind of give you a sense of what those look like. Jill, back to you.
Yep. And this is what we heard for a lot of feedback on is businesses wanted specific scenarios. They wanted this kind of information. And so this really could be useful for your employees to have a chance or for businesses employees to have a chance to look at. The toolkit goes through many different scenarios, but I just wanted to share there are kind of some common themes or common responses, no matter the scenario. Number one is offer alternatives. So perhaps someone can't show proof of vaccination. Well, could they get takeout? Could they get delivery? Is there an outside seating option for them? Is there a streaming option for them? Trying to find those alternatives. Number two, never engage a person who is violent. You can ask someone to leave, but know that your employees will not be penalized in any way for not engaging someone who is being belligerent or violent. The order is also, it should be implemented and for all customers and patrons equally. So it should not be used to discriminate against anyone for any reason. And the other thing to keep in mind is that there are some people who have some disabilities who might need an accommodation. So that could be giving verbal confirmation of vaccination status rather than the proof that is outlined in this toolkit. So being aware of that, making sure employees are aware of that so that they don't discriminate or treat anyone inequitably. And then Markham is going to walk us through a specific scenario.
Sure. And this is the one that we've heard a lot from businesses about an area of concern, and particularly for their staff, being in a situation where a customer or patron, when asked for proof of vaccination, resists providing it. So not only are they just kind of like dancing around or potentially like drawing it out, they're actively kind of saying, no, I'm not going to provide that. And so as Jill said, really, it's first and foremost explaining that this is a mandatory order. This is not a decision that the business is making. This is the business complying with a public health order. We're trying to keep people safe. We're trying to keep people healthy. Second is, as Jill mentioned, really offering alternatives. As Taylor mentioned in her presentation, this is only applying to dine in. So if you're at a restaurant, if you have outdoor dining, if you've got takeout, if you've got other options, you still want them as a customer. And so you want to just try and figure out, is there something else that's going to meet their need? But not necessarily like inflame the conversation anymore. Third, you want to do your best to enforce this order, but at a certain point, you're just trying to de-escalate the situation because you can kind of tell that it's gotten to a point where there is no kind of good outcome out of this if the conversation continues. And so you kind of just want to make sure that your staff is comfortable removing themselves. Certainly, we know that calling law enforcement is fraught with its own set of issues. And so that's used as like a last resort. But if somebody is belligerent, if they are threatening or harassing employees, if there's a potential that the situation gets violent, certainly you got to make sure that people are safe at the end of the day. So we tried to give a bunch of scenarios and a bunch of different ways to go through the checklist of kind of getting yourself out of a potentially bad interaction. Many of your staffs are already going to be trained with this for people who are intoxicated, or otherwise belligerent or acting poorly. But we want to make sure that staff in particular feel comfortable and confident as they're trying to enforce this order, but also make sure that they recognize that at the end of the day, their health and safety is much more important than getting that proof of vaccination. And so it's a do your best type of situation with some alternatives being able to be offered. And with that, I think we're going to wrap up our presentation, go back to answering questions. Final couple things. One, this order goes into effect Monday. I know we're kind of beating you over the head on that, but it's really important that every business, and particularly those that are impacted, know this, and that you have to have signage. We have a variety of pickup locations where we have printed signs available, and we've got a handy dandy map at the kcvaxverified.com site. Also, if you go to any King County library, you're able to print one on demand for free. So those are also listed on that map. We are doing a major push right now, and we just had a slide up with the social version of a social media post that we are doing, or social media digital ads on a variety of different periodicals throughout the county, a lot of ethnic newspapers, a lot of local newspapers. We're doing a huge push kind of over the weekend to try and saturate the market and make sure that everybody knows that this is going to be a requirement. So if you folks who are joining us on the webinar know of other businesses that maybe haven't heard about this, give them a reminder. Like, we want to kind of spread the word and make sure that before Monday, we have as many businesses aware of this and grabbing signage as possible. With that, if you have any questions, I guess we can go to the Q&A.
That sounds perfect. Thank you. So, yep, we're going to start the Q&A portion of the program. A reminder, we are recording this webinar, and we'll send out a transcript of the Q&A answers with the links to the webinars, the slides, and the resources as a follow-up to you. Okay, so our first question asks, how does this policy apply to nonprofits, which primarily serve members, not the public? How can we implement these guidelines, even though we don't fall into one of these required businesses that has to comply? So is that a Shannon question? Yeah.
I'll try to take that one. So first of all, it kind of depends on the situation the particular nonprofit is referring to. The situation I think of course, is like an event. If a nonprofit is throwing a fundraiser, but the situation there would likely be they might be using a facility that is indeed falls under the vaccine verification. I think, though, if I'm understanding, part of the intent of the question too is like, can we also just require these guidelines if we choose to do that? And the answer is, of course, yes. We would encourage any business who was interested in doing that, nonprofit or other, to go ahead and do that. And certainly you could, use these guidelines as a tool, even if it was not a mandatory requirement for that particular event. And then while I have the floor, I do real quick just want to, in the space that we were just talking about related to enforcement or concerns there is a number that is on the signs for folks that is a King County line that people can call into to actually, report issues that have happened, to provide any of that information, because it's not just about enforcement. It's also about making sure we are able to update and provide information region-wide as we learn about things that might be coming up related to implementation. So I would also just say I really encourage people to contact us if they are having issues with the customer or in a particular venue. So I just wanted to put that on the table.
Thank you, Shannon. Okay, we have another question here. It says, or it asks, there are many businesses currently short-staffed. What advice do you have for those of us who are worried about how we might find the time to check vaccination status on top of all the other things we need to get done?
I'll go again. I totally appreciate that question. Thank you. That is one of the reasons, actually, after some of our early engagement, one of the things we realized was that our order, for example, said prior to entry that vaccine verification needed to be checked. And one of the things we heard from some businesses were like, wait a second, what if somebody's just coming to get takeout? We also can't just hire somebody and have them stand outside the door. That's an unrealistic expectation. So we revised the order to take out that prior to entry language so that folks could operationalize it in a way that would be most efficient for their business. So you are still following the intent of the order. If somebody comes into the door, then sits down, and then somebody perhaps comes and checks their verification as they're about to order something or they're preparing for whatever the activity is. So those are, from my perspective, some ways to try to manage that, but I don't know if Markham or folks have other recommendations in that space.
I think that's right. And that's what we've seen and heard from a variety of different businesses who have been already, some of whom have already been doing this, is they've figured out where it fits into their natural flow and then kind of just inserted it as another thing. So as Shannon was saying, like if you're handing somebody a menu and you're already kind of there, like just also ask for proof of vaccination. Because we have heard that same concern that particularly in the hospitality industry, there's a lot of short staffing. And so just figuring out how to empower your staff to ask the question, but make sure that it's kind of within the normal flow of business.
And then I'd also like to add that, for example, with hotels, if you know that your guests are staying a week, you don't have to continuously ask them. One time is sufficient for that type of situation.
All right, perfect. Thank you. Our next question asks, are small retail businesses required to request proof of vaccine? Maybe this is a Taylor question.
No, they are not.
That was quick. I turned on my mute button. All right, let's see.
Add to that, the business toolkit has a handy box of what is included in the order and what is not, and would answer a lot of those sort of location questions. So again, I think if you refer folks to the toolkit at kcvaxverify.com, a lot of what's covered, what's not is right there.
All right, perfect. All right, we got another question here. It asks, we have a 3-day event coming up soon. Should we verify vaccination proof every day, or can we record each person's vaccination proof the first day and not ask again?
Yeah, I can go ahead and take that one. So that is a very common question, especially for conferences. You can just record everyone's vaccine info on the first day. That way you don't have to continuously ask them. And then use your best discretion if you do see someone that you might not remember or that you got it wrong. That's my recommendation there.
And there was a related question, I think, in the Q&A that Shannon answered around like gyms or membership organizations where you can actually record somebody's vaccine status once, and then as long as you're kind of logging that, that's sufficient, because once somebody's vaccinated at this point, that's good enough for the order.
All right, super. Thank you. All right. The next question we have asks, there is a big group party being organized at my restaurant. Am I responsible for vaccination confirmation in that case, or is the host supposed to do it?
In my estimation, it would be that the restaurant would be responsible unless there is a contract of some kind, for example, that party of folks signed in order to use that space. You could make it a part of the contract that they need to attest that they have checked everyone's verification. So it sort of depends on how the group came together, I think. Taylor, is there anything else there?
Yeah, no, I totally agree. That's exactly what I was going to say.
Love when we're aligned.
All right, we have another question here, and this one's about masks. Are masks optional now that we are asking for vaccination verifications?
So at this time, they are not. There are 2 mask orders actually right now, one at the state level, one at the county level. I will say we are having conversations about trying to navigate that, because I do think we see some value in trying to create a space where masks would be optional under a vaccine verification venue, for example. But that is an ongoing conversation. And if the state order is in place, the King County order can be stricter, but ours cannot be less than whatever the state order is. So it's a little bit of a sticky situation as well while both of those orders are in place.
I had a follow-up to a question we asked earlier. We were talking about the small retail. This question is from a paint ceramics business where they're kind of close and sitting together for a while. Yeah, still not in that category?
I mean, I would say still technically not in that category. And okay. I would, on behalf of Dr. Duchin, emphasize any business can choose to require vaccine verification, certainly on their own, if they feel that's an environment where it would be the healthiest thing for them to do for the community or for that business. So.
All right. So the next question asks, I work at a restaurant. Can I just record a customer's vaccine status once and not have to check it every time they come in? I think we sort of answered this, but.
And I think what I would say is the reality is if you're in a space where you legitimately know a customer, we aren't requiring the tracking of customers because that just seemed like a real burdensome thing for businesses to have to do. But much like the answer to the fitness center, for example, or some other, if that is a realistic thing that a restaurant could do, sure. But we do have the expectation that there is, verification of vaccine for everyone in that space. So, but yes, I think if they could create that in a way that it actually worked for them, sure.
Okay. All right. So our next question asks, in our facility, we have a cafe with outdoor seating, indoor seating, as well as a garden to sit and enjoy. People often come in and out of the cafe, and the garden is also an entry to our facility. How should we best track people for their vaccination proofs? This is a tough one. It's very specific.
Can you repeat it for me?
Sure. So it says that the facility that they have, they're a cafe, they have outdoor seating, indoor seating, as well as a garden to sit and enjoy their food.
Mm-hmm.
People often come in and out of the cafe, and the garden is also an entry to the facility. How do they best track the people for their vaccination proofs? Or maybe there's some ideas that we've heard.
Yeah, my recommendation, again, having no operational knowledge of the specific space, but my recommendation would be, because outdoors is not part of the vaccine verification, they can be dining outdoors. I would say to check vaccine verification for the individuals as they sit down indoors in that space and are choosing to stay indoors to enjoy their food or drink.
All right, I think that sounds like a good recommendation. All right, our next question asks, with this vaccination mandate in place, can we think of closing the windows as the temperatures start to decrease?
Okay, that is a doozy of a question. Dr. Duchin feels very strongly about good ventilation and the importance of good ventilation. I think part of the reason we're, the vaccine verification this time of year is particularly important because of that very issue. We certainly know that ventilation is not going to be as realistic an opportunity this time of year. So of course, people need to do what they can do to create comfortable environments within their venues. And that's great. But again, on behalf of Dr. Duchin, I will say, I think any way that you can create more ventilation in any indoor spaces, whether that's your home or a restaurant or whatever the case may be, he would certainly recommend that.
All right, thank you. All right, let's see. The next question asks, should we be asking for proof of age when we see a child in the group of customers?
Oh, no, we have no requirements to check proof of age. And actually, this is a number, I don't think we've talked about this one here on this call. And we had this very good question sort of early on in this process. It applies to people 12 and over. So if someone is coming in and you ask, for example, oh, are you 12? Like just ask the question. And the answer is yes. And they've just started getting their vaccination, but they're not completed with it yet. That child should still be allowed into the venue. So we've created language in our FAQs to cover this that basically says if an adult is with a child in that space and attests to the fact that, yes, they are getting their vaccination, that by all means, you could let that child into the venue. And we understand there's just a little bit of give time for when people are eligible to be vaccinated.
And I did just want to add, there is a grace period. So normally it would be about 4 to 5 weeks between the first and second dose being completed. So we are acknowledging that as the grace period, in addition to the parent or guardian saying, hey, they're in the process of being vaccinated.
All right, perfect. Okay, the next question asks, is there a resource we can refer to make sure vaccination proofs from outside the United States are real and not fake?
So for that one, I don't know if we have actually photos internationally of every vaccine verification. So but we do have, I think we have some examples of some of them. I'm not sure if Markham, those are on your website at all yet, or if our folks have been able to do that yet. But generally speaking, I think we should, as I keep saying to folks, let's assume good intent. If someone is there and says, this is, my vaccination from wherever they are from, I think we are accepting all vaccination certifications that are also from outside the country. So if you question it, certainly, and after the fact, by all means, you could give us a call if you're like, suddenly we've had, 40 people today who appear to be from Croatia and have this vaccine verification, and that's unusual. Give us a call and tell us about that. But I think for the purposes of the verification on the site, yes, you should accept international certifications.
Yeah, I'd agree. We've been trying to track down examples from different countries, and it is complicated, as you can imagine. And so I think Shannon nailed it. It's assume good intent. If someone is showing you proof of vaccination, that counts for you doing your due diligence as a business. But I think, as she mentioned, if you're seeing like some weird activity, please report it, because this is all brand new and we're trying to understand, the county is trying to understand what exactly is going on, and then make sure that we're responding to it in time.
Thank you. That's good. All right. Our next question asks, I think I know the answer, but I'm going to let Shannon probably answer this one. Should I ask my employees to show vaccination proofs every day as well?
This order does not cover employees. So that is not necessary under the tenets of this order. Certainly a business can require it of their employees. That is at their, they're obviously have the authority to do that on their own. But it is not required as a part of this order.
Okay, so the next question, we got a lot of questions. All right, so what are some of the best strategies to politely deny service to unvaccinated customers who don't have a negative COVID-19 test? This is a Markham question.
Yeah, I mean, it's got to be kind of within your personality as a host or a waiter or whatever it is you're doing. And also kind of consistent with your business philosophy and kind of how you represent yourself to the public. But generally, I would lean on the fact that this is a public health order. Again, this is not the choice of the business. And if they're not willing to show proof of vaccination or proof of a negative COVID test, then you can't serve them indoors. Again, go back to the alternatives. Is there a different way that we can serve you? Can we get you some takeout? Can we seat you outside? And then if they're not accepting any of that, then at some point you're just going to have to say, then due to the public health order, we're not going to be able to accommodate you at this time.
All right, thank you. Okay, this next question is about kids' sports. Is this applicable to indoor sporting events like my kids' high school basketball game?
I could take that one. So no. So if it is happening at a school on the school grounds, it would not be covered under this order. Only community centers, aquatic centers, recreational centers, things of that nature.
All right, perfect. That was a quick and easy one. All right, so here's the next question. It says, are the public education social media messages and graphics available so we can share on our social media channels?
There are a ton on that website that was on my slides, and I can also share some additional signage and things like that you can use at your business.
Perfect. And a reminder to everyone, we will have all the information here, the answer to the questions, the links, the slides, and we will send it as a follow-up to you as well. So thank you for that. Okay, so here is the next question. How is this mandate being implemented? Is it possible for customers to complain somehow if there is a business that is in not compliance with this new policy?
Yes, as I said, all of the signage will actually have that number, which I think is 206-477-3977. Hopefully somebody will correct me if I'm wrong. But yes, you can call into line. We have actually added, thank you, Taylor. We have actually added folks to our customer service team to be able to manage those calls. And we're working in partnership with the city of Seattle as well. But by all means, yes, please call and let us know if you have concerns in that area.
All right, thank you. All right, next question. My restaurant is on the ground floor of a corporate building, and the seating area is often used by employees from other businesses in the building, even if they are not my customers. Does this policy apply to me?
That's interesting. It sounds like, I guess the question is, if it's an actual restaurant with walls around it, the answer is yes. If people are in there and in the seating area, it would apply. if, and this sounds like it could be the case, it's on the first floor and it's more like a cart style that has open seating that anybody who comes in, whether they go to the restaurant or not, are allowed to sit in that seating. It's not dedicated to the restaurant, then no. That makes sense?
I think it does.
Okay.
Yeah, I think that made sense to me. Okay.
Great.
All right. Our next question. There is a faith-based event happening soon in my restaurant, along with dinner for 60 people. Am I responsible for verifying vaccinations in this case?
I can take this one. So if it is a faith-based organization, they are not required to show proof of vaccination, even if it's in your restaurant. And this goes for any faith-based organization, wherever they are at. They are not required to show proof of vaccination.
All right, good to know. I don't think I knew that. Okay, the next question, they just keep coming on in, I got to tell you. All right, at my business, employees are scared that we will be penalized for not following the mandate in case we approve fake vaccination cards by mistake. How should I train them? Are there specific things we should be looking for in the vaccination card?
So it's not on the business to check the validity and veracity of the vaccination card. Obviously, we want to try and, again, if there's weird trends or you're kind of seeing things that are clearly fakes, if someone shows up with a Post-it note that said I was vaccinated, it doesn't count. Like I think they're like, if the stuff doesn't pass the smell test, it doesn't count. But it's not the business's responsibility to check whether or not the card is valid, nor is it the responsibility to kind of record that. So again, it's kind of best intentions. We're assuming best intentions. We're trying to ask people for proof of vaccination, and if they show something that looks valid, accept it and move on to the next customer. And I'll also mention, and Shannon, or Taylor, you can jump in here, but King County has been very clear with us that their education first is when it comes to enforcement. So it's not like on Monday, if someone shows you a fraudulent card and then they report you to King County, you're all of a sudden going to get a fine levied against you. That is not the intent here. That's not how King County is going to operate. It's not like the policy switches on and all of a sudden fines are going to start raining down. It's very much educate first. We want to make sure that people feel safe. That's the entire kind of intent of this order. And so assume best intentions, but if you're seeing weird behavior, please do report it.
All right, next question. My colleague owns a winery. They were wondering if events like wine tasting will come under this policy. Is that a Taylor question or Shannon?
I think the answer is yes. I believe we've clarified this in our FAQs, but I would need to check that, but we've had this discussion a bit. We would treat that the same as we treat, frankly, like, a bar or a restaurant or anywhere where a mask is, removed indoors, eating and drinking. So I would say yes.
All right, we have another question here. It says, a conference is happening in my banquet hall, followed by a dinner. Are the customers supposed to be asked for vaccines before or after the conference? Water and snacks are open bar, which makes my situation difficult.
For the conference, verification should be checked. Yes.
So then that would imply that they should already be checked before they get to the open bar type scenario. Got it. Okay. All right. Another question here. Why does this mandate not apply to flight travel? People sit so close to each other eating and are without masks.
That is outside of our jurisdiction. So this flight order sorry, these are long weeks. But,
I know.
this health order only covers the jurisdiction of King County. So that is out of our scope.
Okay, here's another question. It asks, there are indoor malls that are planning to have festivities and small events for Halloween in the general area of the mall, not inside the stores. Would the mall owner need to check vaccination status prior to entry in the mall, even though many patrons are there simply to shop and not attend the events? I know this is a specific question, they say.
It is. It's a good one, though. These are the kind of things we're trying to get to. So really appreciate it. And I would say no, because again, that's a more transitory environment. It is not so yes, let's just go with no. Plus, I'm going to make an assumption it would be a lot of people under the age of 12. So no, I would say that does not apply.
All right, sounds good. And I think I have a last one. This should hopefully be an easy one, or last one so far. Who knows what will come in? It asks, why are employees not supposed to be mandatorily vaccinated?
So the issue here is that employees are covered. There's a few different things happening. One is the federal government has an order out related to employees. The state labor and industries has guidelines related to employees for COVID infections. And one of the things we heard, and this was a debate and discussion as the order was being put together, was simplicity and clarity and not changing it once it's being implemented. And it's quite possible if we had employees covered under this order, we'd have to adapt or adjust it. Once the federal government figures out the steps they're taking, potentially the state might be taking other steps. So we are leaving that one to the federal government and the state government to figure out.
All right, sounds good. Well, I don't see any more questions, but I'm going to give people like a minute or two to think. And while we're getting people a minute or two to think, I'd love for y'all to give your kind of last words of wisdom, like 30 seconds to a minute. Like what do you recommend to our participants here?
I'll just take a minute to, again, say thank you for the partnership, and please continue the communication with our partners at the chambers, One Redmond, other business organizations, and ourselves at King County and King County Public Health. We really do want to provide as much information as possible to make this go as smoothly as possible, and to emphasize, again, what Markham had said, and to steal a line that someone used in one of these webinars: there will not be public health stormtroopers out looking at people not precisely following the verification order. We are assuming good intent. We will indeed follow up if we are hearing about patterns of non-compliance, and we certainly expect that people will comply. And we're very fortunate to live in an area that already does have a pretty high vaccination rate. So we think that bodes actually very well for businesses as well. And I just want to appreciate, again, people taking the time to learn more, to ask really good questions, and for your work that you all are doing to keep our community safe and thriving. We really want to keep our businesses and this economic recovery moving as we get to the final stage of this pandemic. So thank you.
3 quick things. One, Christina, Margot, and Samantha rock. You guys are such incredible partners. 2, just a reminder, this goes into effect on Monday. So please get your signage, go read up on the toolkit. And then the third thing is go visit kcvaxverified.com. It's got everything you need to get ready for Monday. Thanks very much.
And I just wanted to say thank you all for having me today. And please, if you have any questions, no question is a stupid question. I would be more than happy to assist. I will be answering questions from businesses, probably the duration of this order. So please feel free to reach out to me directly.
Super. And guess what? We got 2 more questions in. So I'll go ahead and quickly try to get those in. This next question asks, how about people who were vaccinated in March? Will the expiration of cards be considered soon?
So at this point, no. And our hope is, and since this sort of came up, we will reconsider this order in 6 months or sooner. So if public health and our public health officer is seeing trends that make him feel we don't need this order in place anymore, we will lift the order. There's no intent for this to be permanent. We just don't know what factors are at play related. Obviously, the evolution of the COVID-19 variants is quite something. So there's no one trigger we can point to as to when the order will be lifted, but we will be assessing and reassessing the order as we are moving forward. So, but at this point, no.
All right. Okay. And this should be the last question because we are getting close to the end of our hour here. So if there are updates to the order after it launches on October 25th, how do we stay informed? Is there a mailing list we can subscribe to for updates?
That is a great question. And first of all, boy, I sure hope that doesn't happen. And yes, absolutely. We have our public health. We have a space where you can provide that information. And then I don't know, Markham, if you all have a list together of businesses in particular as well.
We do. You know what my answer is going to be. It's going to be go visit kcvaxverified.com, because in the upper right-hand corner, you can put your email address in. And anytime there's been changes, we've been sending out emails I know that the folks at One Redmond and One East Side have also been doing the same. So we're trying to kind of flood the zone. So when a change happens, you should hear about it from somebody. But that's a great way to stay updated and informed.
All right, perfect. And I know we have a couple more minutes, and I want to make sure we give Jill and Bella from Monument any last words of advice you'd like to share.
I think that Shannon and Markham and Taylor said it best. And we'll just give the final shout out to go to kcvaxverified.com.
Excellent.
We need
Excellent.
t-shirts to just start wearing at these webinars.
I agree. Well, I want to thank you all, not only for your time and expertise today, but for your partnership. And Markham, Seattle Chamber, you guys rock too. So right back at you. All right. So this concludes our program for today. Thank you again for your expertise. We appreciate very much. I want to thank again all our partners on the East Side who are working hard to support the business community. Make sure to bookmark this site, oneeastside.org/spark. There you're going to find key resources, information on our one-on-one advising, our weekly webinars, grant opportunities as they become available. Another reminder that there are additional webinars around this topic of the vaccine verification mandate, and these have been produced by the Seattle Metro Chamber of Commerce and the Seattle Southside Chamber. So definitely go check those out. We have links to them on our website as well. This next slide shows you some key resources that are available to you from King County. And as you are out and about in your community, I think we talked about it earlier today, let's work together to support our community as customers and as patrons. And if you encounter a business who is not aware, please share these resources. And I think our last slide really represents as East King County, we stand united. And if there is aggression around these issues, please reach out to King County Office of Equity and Social Justice. In the chat, we'll have a flyer that includes contacts that you can follow up for assistance. And then I think that is the end. Oh, wait. Yep, that is the end of our show. So sorry, I thought we had another more slide. A big thank you again to all our speakers, and a big thank you to all of you for participating. So until we see you again, this concludes our webinar for today. Thank you.